Hi, this is Teresa Martin from Lower Cape TV. Welcome to this episode of Legislative Update. With me today, flying solo this month, is State Senator Julian Cyr. Welcome.
Hi, Teresa. Good to be with you.
So the year is winding down, believe it or not. What's going on? How are we wrapping up the year at the State House?
Well, at least from a legislative perspective.
Right.
So we concluded our business before the Thanksgiving holiday on November 20th and sent a number of pretty significant pieces of legislation to the governor's desk. A landmark package on education funding for K through 12, a bill to put Massachusetts in the vanguard of tobacco cessation, and particularly addressing tobacco use in children. The first step in a mental health bill, a series of a package of mental health initiatives we'll be taking up. Also resolved hands-free legislation. So it was a pretty busy November. And a pretty busy chunk to the first part of the session. So some good accomplishments that mean good things for Cape Codders and Islanders.
Can we talk a little bit more about the mental health bill? Because I know, especially in our part of the world, services are hard to come by. We've talked about how, especially people with children who have mental health issues are told they have to drive, 3 and 4 hours. Is this going to address any of that?
So the state of mental health in the Commonwealth is dire, and that's for folks across the lifespan, right? Whether it's children, adults, folks in their later years. It's really sort of unfair to say that we actually have a mental health system, because a system sort of implies sort of a continuity. We don't have that. We've got a very sort of fragmented access to care, both inpatient and outpatient for mental health. And so this is something that I've been spending a lot of time on. I'm the Senate chair of the Joint Committee on Mental Health, Substance Use, and Recovery. And the Senate president, her number one priority, this is Karen Spilka, who's a relatively new Senate president. Her number one personal priority is to see transformation of mental health, in part from her own experiences and her family's own experiences. And so I'm one of the senators sort of tasked with figuring this out. We passed a bill related to children's mental health and wellness. We actually passed it in the Senate. It was passed in the House previously. I actually served on the conference committee that negotiated this. So the conference committees are 3 members from each chamber who negotiate compromise legislation. This is the first conference committee I served on, and I don't think it'll be the last. And we do a few things. The biggest one that's sort of most important is if you've ever picked up the phone or went online to your insurance provider to look for a behavioral health care provider. Say you wanted a therapist or needed some support with addiction. There are directories that are maintained of providers that are frankly just completely inaccurate. They're really called ghost networks because they frankly don't exist. And so the compromise bill we passed and has been signed into law by the governor really changes that and requires some significant reforms to those directories. We also take into account children who are in the foster care system, who are under the care of the Department of Children and Families. And we make sure that they have mass health coverage until they're 26, which is coverage that's sort of consistent under the Federal Affordable Care Act. Young adults until their age of they're 26 can stay on their parents' insurance. This is doing the same for kids in foster care. We established a number of commissions and studies to give us more information that we can take up later in the session. The one I'm most interested in is around school-based health centers and really looking at how schools can be locations for both, certainly for mental health care and also a broader range of health needs. But this is very much a first step.
That's what it sounds like.
This is sort of a quick compromise bill we could get done early in the session. We're going to be coming back to this. I expect you'll see the Senate take up a pretty comprehensive piece of legislation around mental health. I'll be intimately involved in that, so we'll be hearing a lot more about this. That's good. But we wanted, I think, to do something and then to really come back to this issue in the winter and spring and make sure we do something big and we live up to the Senate President's vision, which is nothing less than transformation and parity in mental health.
Well, the two things this took on just 2 really concrete things that pretty much everyone agrees is bad. Having networks of providers that actually exist, as opposed to ones that are just names on a list that aren't there. That's gone. And making sure that kids in the foster system don't fall between the cracks with no health care.
Exactly. So there's a whole host of more work needing to be done.
But it's concrete, 2 very concrete specific things.
And what we'll see more, right? looking at, access and more about insurance coverage, really workforce and how do you develop a pipeline of talent. So a whole host of issues that are coming on this.
Yeah.
But it was a good first step.
It's good. And I'm glad we're talking about this issue too, because mental health is very real and people are historically not very comfortable talking about it.
I think you're totally right. And one of our biggest challenges, right, is the stigma around this.
Yeah.
And I think that, particularly people who are in leadership positions, and myself included, we've got to get better talking about how mental health has impacted our own lives and our own families.
Yeah.
And I'm someone who certainly has had my struggles, with my mental health, and I'm sort of learning and figuring out how to talk about that more, really, so we can really combat, really address a lot of stigma and a lot of unwillingness to really view mental health as part of overall health. It's kind of profoundly dysfunctional that we sort of, from a healthcare delivery perspective, we sort of lob off the head and we say whatever's going on in your brain, which is the biggest, most complicated organ in our bodies, that we're going to treat that differently than, say, the heart, the liver, the kidneys, your legs. So we're working on that.
Well, it seems very, very timely as well on a larger scale. I was reading recently about deaths among millennials and Gen Z, and that the death rates are appalling. It's like raising all these red flags. It's making the whole country's average, life expectancy drop. And there's the sense there's a mental health component that's part of it, that things have changed in very profound ways, and that people are really struggling. And this seems like just a very timely topic to be addressing.
Yes, I think a lot of folks are struggling, especially if you look at suicide ideation and suicide rates. Those have been increasing. I also think what's changing too is we're more aware of this, right?
Yeah.
If someone were to die, by suicide or even just complications of their mental illness, or illnesses that relate to other morbidities, 20, 30, 40 years ago, you wouldn't talk about it in the same way we do today. So I think there's both. There's an increasing awareness of the need. I would actually argue that need's sort of always been there.
Yeah.
But anyway, lots more to come on this. It's a really rich topic. I feel really honored that I get to sink my teeth into this from a policy perspective and really try to make some change.
I'm going to throw one more piece in there too, because we've talked about addiction and opioid issues a lot over the last year or so, and it seems you can't talk about that without addressing mental health as well.
Yes, though I would sort of argue we have put significant resources into particularly addressing the opioid epidemic. I think we're beginning to see some results. Data recently released by the Department of Public Health looking at essentially deaths related to opioids in the first 9-10 months. We're seeing a slight decrease. The real persistent piece there is the presence of fentanyl and carfentanil and these other sort of highly toxic components that have entered the drug supply. You essentially can't find heroin and other drugs that don't actually have traces of this really toxic, potent substance. And so what we've got to really figure out now is how do you apply some harm reduction strategies, until people are able to, get into treatment and get into recovery. What are we doing to keep folks alive? We've talked about the $5 million investment in this year's budget. So we've got to keep at that. I think that certainly the mental health crisis is related to it, but it's also broader than that, right? And I think from a policy perspective, you try to both address sort of the immediate, you try to address the immediate challenges you've got when the house is on fire, but you're also trying to think ahead, and ultimately have more sort of upstream, we would say from a public health lens, more upstream interventions and approaches. So a lot of really interesting, rich work, and it's an honor to work on it.
Well, the other really big thing that has been signed now this week, something we talked a lot about last time, the education reforms. Can you really quickly highlight what actually is now real?
So this is huge. This is the largest thing that Beacon Hill has done on education since 1993. But what we found out, right, was there was real persistent gaps. Gaps in how we were counting low-income students, gaps for English language learners, special education. So this is a $1.5 billion investment over 7 years in K through 12 education. This is significant dollars. It's going to mean We're counting low-income students. The old formula counted about up to 133% of the federal poverty level. We're going to 180%. We put more dollars and we change how resources go for English language learners. The old system basically gave you more resources for little kids who are English language learners and less for bigger kids, which doesn't really make sense, right? You got a kindergartner who's an English language learner. They're going to pick up the language much faster than a sophomore or junior in high school.
And the academic content they're dealing with is very different as well.
Precisely, right? We do some good work around more resources for special education. The special education circuit breaker, this is a reimbursement for those costs, traditionally never included transportation costs. It was only instructional costs. Now we're including transportation. That's a big deal for a place like the Nauset district. And then we also, there's a number of other things the bill does, but one piece I think relevant to us here on the Lower Cape and the Outer Cape is a really strong study at the needs of rural schools and schools that have declining enrollment, which is actually what we have here. Most all of the towns on Cape Cod have declining enrollment. The exception in the Cape and Islands district is on Nantucket, where their enrollment is actually increasing, largely actually driven by immigration. So this is a huge, huge deal. It's going to mean real dollars right here in the Nauset district. It's going to mean resources, across the entire Commonwealth. And we're really focusing on really our neediest students who've been left out, and really trying to get at persistent achievement gaps. So it's a big, big deal. I'm the only member of the Cape and Islands delegation who's on the Education Committee, so I got to have a hand in shaping the bill that came out of committee. It was taken up in the Senate, it was taken up in the House, and the governor just signed it. So now it's law.
It's real. This is real. This is very exciting.
Yeah.
So, believe it or not, we're running out of time. But
what else have we been doing?
And also, this year is wrapping up. So, what happens between now and when you're in session again?
Sure. So, I want to talk about one more thing we did, which is a pretty substantial act around modernizing tobacco cessation. We're here, we're filming at Nauset, High School. This is a place that has had such a challenge with vaping that they actually, for a period, removed the bathroom doors from bathrooms to prevent kids from vaping, during class or sort of in between breaks. We've got a crisis, right? We've done a really good job sort of reducing tobacco use among young people until these vaping products, and particularly vaping products with flavors, came out. So the House passed a bill, the Senate passed it as well. The governor just signed it into law. And under the new law, vaping products and all tobacco products with flavors will be banned. So no more, I don't know the flavors off the top of my head, but
bubble gum and popcorn and cotton candy is
Mango,
a big one.
I think is very
and then
popular.
the mix-up one, which is like all the flavors all mixed in together.
And we also ban, included in that flavor ban, is mint and menthol, because we know, and we're the first state in the nation to do this. So we're on the vanguard here, which we like to be on public health. Mint and menthol, we know, would be the product that big tobacco would turn to if we banned the other flavors and try to really market this to kids. Mint and menthol has also been the product that big tobacco has used from a predatory perspective against the African American community, the LGBTQ community. 90% of African American smokers smoke mint and menthol, compared to about 30%, a little less than 30% of white smokers. That's because of specific, targeted, predatory marketing practices in that community. So this is another big deal. It puts us in the vanguard. Yes, of public health. We're trying to stem this real spike in nicotine addiction in young people. And we're also really trying to make sure that we're not creating another generation of folks addicted to nicotine, which, from a personal perspective, impacts people's lives. And from a healthcare cost perspective, really adds a lot of cost in the system. About 10% of our costs, even in the healthcare system, are related to tobacco-related diseases. So another big win. You asked sort of what happens next.
Yeah.
So we take a little recess, and folks are going to enjoy the holidays, spend time in district. We'll be back in session in early January, and there's a lot on the agenda. For the Senate, there's two big things. One is the mental health legislation I mentioned.
Right, continuing that process.
Continuing it and really doing a sort of a second and more robust bill. And the second on the agenda is some meaningful action on climate change, addressing the climate emergency. This issue, there's sort of no issue that's sort of more important than the climate emergency here on Cape Cod, at least from a longer term perspective. So we're going to do that. I hope we take up some housing legislation, and that'll keep us busy. We'll enter budget season, of course, going into the spring.
You're going to solve all the world problems, right?
I don't know about that.
Then what do you have to do?
And then we go kind of full steam ahead, and the end of the session is July 31st. So a lot of work ahead in the next 7 or so months.
Well, that's incredibly exciting. And I just think it's the three that have passed to me, are very interrelated to each other. It's all about sort of health and the next generation. And that's a pretty exciting thing to have our Commonwealth be really leading the way in.
We're trying to lead the way. We got work to do, but yeah, it's certainly exciting to be a part of it.
That's great. Well, once again, we are out of time, and this is Teresa Martin from Lower Cape TV. With me today has been State Senator Julian Cyr, and as always, it's been a pleasure.
Always a pleasure. Take care. Have great holidays, and enjoy the season, and we'll see you, if not in December, then in the new year.
That's right. Thanks.